Do not go where the path may lead. Go instead where there is no path and leave a trail. So said Emerson in one of his most famous quotes. And thus, it has been my great privilege and pleasure to bring forth all these distinguished illuminaries on the dais. I would love to introduce our distinguished members of the dais, and we will be inviting them with flowers and shawl. When we actually present our distinguished members on the dais with the flowers and the shawl, please remember it is actually, they are representing you. So we are actually giving it all to all our guests over here. And that is you. You have made this convention a wonderful success only because of your presence. We have right in the middle, of course, our health minister, which I will introduce to you as he comes. And then around him, we have Dr. M.P. Sham. Dr. M.P. Sham is the president of the RSS Trust. Please, sir, forgive me if I am wrong, but this trust has been formed in 1940 and with a dedication only to education. This is a representation of the Actors Guild of Karnataka, and my humble apologies. No problem. Thank you so much, Mayur, for accepting to come here. Please, here, in between Vidya and here. I think a lot of you might have seen Mayur Patel's movies. Dr. Vidya. And we'd also like to thank Satish Kadabom. Satish is a dog owner, breeder, and I don't see his 30 crore dog that he has brought. Is it come? Yeah. So he has a dog which is a panda dog, and that dog is worth 30 crores. And he's the supplier to all the celebrities and everybody. I have already introduced Swami Chaityanand Saraswati to you. As I explained to you, he has two pontiff gurus. One is in Rishikesh, Dayanand Saraswati, and the second is in Sringeri. He is an economist, educator, and lots more. Representing India at the United Nations is his forte. But along with that, he also is the Vice Chancellor of the Sri Shim University, where they teach students management studies. He has authored several books, which I forget and don't have such a big count on that. Then we have Dr. Subramania. Dr. Subramania has over 30 years of experience in engineering. He has mastered so many areas. Most important is some hybrid. Sir, I'm not an engineer, so I don't really understand so much of it. But I saw that hybrid and I said, wow. So there's one very good saying by Henry Royce: if there is something that exists, make it better. If it does not exist, create it. And that is the team to which Dr. Subramania belongs. So we are very thankful to Dr. M.P. Sham and Dr. Subramania for, thank you so much. Your humility is absolutely stunning, sir. And what I'd like you all to know is that for the last 7 years, the International Society of Gene and Cell Therapy has been thankful to this team of RSS and RV, because the Mercedes car that you are being driven in, especially my faculty, is being only because of Dr. M.P. Sham. Thank you so much, sir. It is such a privilege that we have our faculty actually picked up, dropped, all with wonderful drivers and doing such a wonderful job. At every level, even down to the students, we can see the reflection of user. Whether it is Dr. Vidya Niranjan, Dr. Subramania, or these wonderful students all around us who have made this convention possible. That reflection is there in you, sir. Thank you so much for being with us and giving us this opportunity. We have with us Mayur Patel, and Mayur Patel is a wonderful actor. I think your movie came out in 2006. 2003, correct. And some wonderful, wonderful movies, and he has also taken part in The Big Boss. And these are some things which are very entertaining for all of us, because India, thank you. India itself is a very voyeuristic society. We want to just see. Rest of it, we don't want to do anything about. So we're very thankful to him for taking this time out to be with us today. I'd also like to thank Dr. Satya Prabha, who's heading NIMHANS Neurophysiology. Once again, a very, very strong force with ISGCT. She has been there with us from 2017, and we really, really appreciate her endeavors in taking this field forward. I have with me Dr. Bhuvneshwari and Dr. Brinda Devi and Palani Muthu. You have heard them all today, and we have described all of them to you. On this side, I have Dr. Vidya Niranjan, Dr. Jairam Reddy, and Nisha Rati. These are all the actual pillars of this convention, and they are the ones who have given the scientific back knowledge for every one of us to share and enjoy. This whole society itself is in its infancy, and so we are not really able to appreciate all the doings that have gone on in the last 7 years. But I give you an assurance that this young India is going to bring it to further heights. And in 20 years, we're going to see a huge development where ISGCT, gene therapy, stem cells, all kinds of genetic modifications are going to be the rule. One you're going to see today itself with Satish Kadabom's dog, which is a cross with a panda and a dog, panda bear. And so genetic modification you're already going to see. We have heard so many lectures today with agriculture, and the green revolution itself has been possible only because of genetic modifications. This way, we are all going to take this team forward in genetic modifications. I would like somebody to play the video, since we are anyway waiting for our chief guest. So this video that I'm going to show you, I was not able to show you because we had to cut short my lecture at that time. We have a formulation. Dr. M.P. Sham, Dr. Subramania were not with us, and Mayur Patel. So I'm going to just explain a little bit to you before our chief guest comes. We have a formulation which is called morphogenetic activator of nucleic acids. This formulation, when it gets in touch with blood or any part of blood, plasma, RBC, WBC, anything, it will make that part of the blood into its fetal stage. So we're looking at fetal stem cells, fetal DNA. Now if I want to treat any condition, I can do that even if there are DNA mutations with his fetal DNA. Why? Because that person has been born and his DNA was good. In DNA and in mutations, we have two variables. One is time. There's a time variable and there's an expression variable. So even if that same mutation exists in another person, it might come at the age of 10, or it can come at the age of 40. So we have a time variation. It can exist in that same 10-year-old with complete blindness, and the 40-year-old has got partial blindness. So this is the video. Just 1 second, pause. Just pause, 1 second only. This is the video which you're seeing, which once again cannot be shown to you anywhere in the world, because you're going to see in front of you daughter cells coming out of that black energy ball. This was shown to me and I would like to say thank you to Narayan and Matarani, because this could not have been possible for anybody to see. There is no stain put on it. There is nothing there. All you're seeing is the interface where blood and manna have met comes out with a black ball and a track. The track also spews out daughter cells, and the ball is bringing out millions of cells. Now, if we are trying to treat cancer, cerebral atrophy, any worst case scenarios, we can do so by giving the injection to the patient intravenously, where manna will come into touch with his blood. Yes, please play. Now you will see the video. This is less than 1 minute video, but you can see the track has already formed cells, and from this black high energy ball, anything which is black in color usually has very high energy, just like the space. Now you're seeing all these cells spewing out of that black energy ball. And this time round, the cells are actually showing you a halo of light. There's light inside them. What that shows us is that each one of those cells is a very high energy module. These are called adult stem cells. These cells are going to go and treat the patient. In science, we have only been taught one daughter cell becomes one mother cell becomes two daughter cells. But here, through this video, you're seeing that's not true. Actually, it can come out with thousands and thousands of cells if the circumstances are right. That we are calling as cell genesis, and you can actually go to YouTube and write cell genesis, and you will find that under my name. After this, we are also going to show you one more video where you're going to see the first second when manna meets plasma of the patient, both having been filtered with 0.1 micron filters. As you can understand, as you can understand, 0.1 micron means 100 nanometers. And that means no bacteria, no virus, no big protein molecules, definitely no cells. Each cell is approximately 10 microns in size. A virus is approximately 0.1 micron, 100 nanometers. Bacteria, approximately 200 nanometers. We have filtered away everything. But now, when we put one drop of manna and one drop of the patient's plasma, both being filtered away, we are seeing in front of us 20 micron sized DNA particles. And you can actually see the ribbons of the DNA getting layered down. As you know, the DNA needs to get ribboned down and layered down so that it can go tight into the chromosome. However, when we are giving this treatment, it doesn't really need to do so. The DNA gets into the circulation of the patient, and that we call as floating DNA. We now use dyes to produce this fluorescence of the DNA. Whenever we want to use repair, we need the floating DNA. It is this floating DNA which gives you younger guys youth and health quotient. So there is always damage and repair. The damage that occurs is usually only on the DNA. This coding part of the DNA needs to make a protein. If that DNA has got mutated, the protein is not coming out efficiently. If that is happening, the body is decaying. If the cell knows this part of my code is not forming, he will send out a message to all the cells and all the body. Do you have this part of the DNA? I need it. Repair me. When you're less than 20 years of age, yes, you do have certain amount of floating DNA which can go and repair you. From 20 to 40, it's going down. So we're not really good at repair. But by the age of 40, some disease has come in. By the age of 60, we don't have floating DNA left that can be seen under the microscope. And thus, we get disease, arthritis, heart attack, blah, blah, blah. So many things. We have always thought that aging is a slow process. However, today's science has shown us that at two places, this non-linear aging takes a linear fragment, and that is at the age of 44 and at the age of 60. Straight, sharp decline. So now what has happened? We have taken studies of cells, and the cells have shown us protein not forming to the best of its ability at 40 and at 44 and at 60. These are the places we need to repair. So when we give the injection, we take 1 drop of blood of the patient, mix it with manna, give it back as an injection to the same patient immediately. Because as I just showed you, it takes only 1 second to form the DNA. This starts sending fresh DNA into the blood of the patient as floating DNA. And it is this floating DNA which is going to go and correct the patient, make those mutations possible, repair that individual. So if there's any molecule on earth that can repair you, it's going to be your fetal DNA. Yes, sir. Do we have any doubts from anybody? स्वामी जी कुछ बोलिए, आपका डाउट बोलिए. Yes, Satish, Dr. Satyaprabha, they've all gone to pick him up. They thought he was already on the way. They've already told us that only. That's what I was trying to do to entertain you guys. I don't have any of the dancers on here now. Okay, guys, you tell me, do you have any doubts? Yes, sir. Dr. Subramania, please, do you have any doubts from what I just showed you? Mayur? No? Actually, this is such a fresh, new topic that it takes us so much time to understand, and then you will have your doubts on it. Sir, thank you so much for being a part of this for so many years. Sir, any questions? Swamiji, why you can't question? You're the one person who can question. Swamiji has been taking the treatment for so many years, so he's the one person who can question us. Yes, Rubin, Satish. Yes, sir. There, Palani Muthu also has taken the treatment. Come on, guys. Think, put on your thinking caps. Distinguished members of the press, your questions is what sends us spurning to get more answers. Because it's only with critical acclaim that a person can improve. And I am indebted to members of the press, not from today, for more than 50 years, that you have always supported our endeavors. Dr. Agarwal, as you already know, is more than 100 years old and 4 generations old. And at every stage, whether it was my grandfather, my father, and now my sons, you are always supporting Dr. Agarwal's. Thank you all very much. But please, I need to ask you some. Give me your doubts. This is genetic engineering at its forte. So if you have, yes, sir. Any doubts? Dr. Kulkarni, please. आपकी कोई doubt है? Yes, sir. नहीं पूछ रहे? Okay. So let me try and tell you what really happened here. I am a 3rd generation of doctors. And as doctors, we have a burning desire to treat the patient, come what may. I have seen in front of me my grandfather, my father, my mother, telling the patient, okay, this is a blinding condition, we can do nothing, I'm writing some vitamins, go home. That pained me. At the age of 12, I was always the uh, uh, class monitor, and so we had decided that we're going to take cancer as our science project. There's a very big institution in Madras, which was run by Dr. Shanta, and that was Autonomous Cancer Board. So my parents fixed up, okay, go. I took all our schoolgirls, we went over there, and it was pathetic to see cancer patients because here they had absolutely, one face going off, something else, lot of pain in their faces, and they were actually suffering with pain. So I came back and tried telling myself, I will get the treatment for this. I will treat their pain. I cannot see another human suffering with this kind of pain. From that day on to today, it has been more than 50 years, but yes, we have somewhat of an answer. Whenever we've given manna to our cancer patients, the first thing we see is within 3 days, their pain has reduced without fentanyl patches and what have yous. My father-in-law had cancer. In 2004, I was only experimenting with rabbits. He told me, come, you put injection first on me. I said, we are not ready for all this. We have to go through clinical trials. We have so much of mechanism to do things. He died. When he died, me and my husband, Pankaj Sondi, both realized this is too much. We should have given him the injection. And there and then, he, my father and me, 3 of us took injection. 3 of us were swimming. We didn't sleep the whole night. My father told me I'm taking 6 tablets of Combiflam for hip knee pain. All that he stopped. We understood that we are on to something fantastic. It is some super molecule that we may or may not even have understood its complete implications. And then we started treating only worst case scenarios. So blind patients, like the patient you saw me giving the injection right into the optic nerve, and different other patients like cancer. When we started seeing cancer, 2 years down the road, pancreatic cancer usually dies in 2 weeks once you have made the diagnosis. Here we are seeing that patient of 2 years, still alive, going by bus. Then it hit upon us that this must be presented to our president and this work should be given to the government of India. We made the whole thesis. We went to meet the president. He was so kind to give us an appointment. Once we met there, he was absolutely flabbergasted. And I am talking about our President Abdul Kalam, because he's itself a scientist. So he was absolutely enamored and he knew what we were talking about. In his room, he has one big plasma screen at that time. The plasma screen we detached. Inside the Rashtrapati Bhavan, as Swamiji will tell you, even a mobile phone cannot be taken in. We took a whole microscope into the Rashtrapati Bhavan. We took over on his plasma screen, took out his feed, fit in a microscope, and we showed him this effect live. Now, if you have to see something like this going live, it absolutely flabbergasts you. How can the cells, which have amoeboid shapes, become round and start giving you such beautiful halos inside? That is exactly what happened. We call this the manna effect. He said and called immediately the DRDO people. He said, no, don't give it to Government of India, but I'm going to give you to the DRDO. DRDO came in. They said, we have 52 labs nationwide. Madam, you're ready to go anywhere. First, I'm a female. Second, I'm not white in color. And third, I do not belong to any governmental organization. So, with all those three setbacks, the DRDO picked me up, threw me in all to their laboratories. We did all kinds of research with them. Their most biggest fear for the DRDO is radiation. So what they made us do, we had a study with them. We took one bunch of white albino mice, put into gamma radiation. They died within 24 hours. Second bunch, we gave them the injection. They went for gamma radiation. They survived 1 week. Third bunch went to gamma radiation, came out. We gave the injection. They survived for more than 10 days. We were not able to stay in Delhi for more than 10 days. So that was the cutoff where we were concerned. This was just one of the studies. There were so many more studies where we did with mice, where we injected the paw of the mice with formaldehyde. So if we had to compare any non-steroidal anti-inflammatory with manna, within 15 minutes, the mice would stop scratching with manna, would continue to scratch his paw for 24 hours if we did not get treated. And with any non-steroidal anti-inflammatory, also it would be for 15 minutes. These are some of the studies that showed us that yes, this is a very powerful project and it needs, we had at that time, because of our work with DRDO, Dr. V.K. Saraswat, who is today on the Niti Aayog. At that time, he was the chairman of DRDO. He came out live on national television to tell people, I have in my backpack of the soldier on the front morphine. However, I want manna in his backpack. Why? Because through these studies, we had shown them that once the patient is injected with manna, bleeding itself will decrease. I was there in Kargil during the war. I'm talking 1999. And at that time, what did we see? The soldiers that came and survived inside a base hospital did not die. The soldiers that we lost were the soldiers in transportation. So it was bleeding that we lost them with. Looking back at all this, what Dr. Saraswat had told us, now makes it even more important that we bring manna to the forefront. You have seen Dr. Rajsekhar in the morning from CDSCO, and there is this whole big lobby of people who are bringing manna that it should be available to us from Salem, Massachusetts to Salem, Tamil Nadu. That means we have a global input. It should be that simple for anybody to use. But before that, we need manna champions, which we have right in front of us. So that ISGCT is that platform where you all can get up and talk and describe what you have done in the research of genetic engineering. Yes, madam, any doubt? Yes, my lovely audience, any doubts? Yes? Come on, if you're thinking, then only you'll have doubt. What is your doubt? Come on. Tell me your doubt. How is this possible? What have you done? Come on. What is your doubt? Yes. Sweetheart, what's your doubt? Any? Huh? Wow. See, now we have a lovely question. Is it affordable for the poor? The first thing I'd like you to know, and I think you already know that, 90% of all the work that is done in any Agarwal center is for free. So the affordability comes that we go out and hold camps. We go out and hold these kind of teaching programs. But each injection will cost, if the patient comes into the hospital, 5,000 rupees. Now, if you think 5,000 rupees is affordable or not, it's a double-edged sword. The patient does require 10 injections. Those are the parameters. Wherever stem cells and DNA therapies are concerned, the expenses are exorbitant. And that's why the costing in different areas and platforms are even more expensive. For example, there is one particular gene therapy done in US which costs $450,000 for just one injection. Then they have a lot of inclusion criteria, exclusion criteria. Here we have none. We include everybody, we don't exclude anybody. It doesn't matter if the patient is 0 days old or 120 years old because we have treated them all. 18,000 patients over the last 20 years, each patient getting minimum 10 injections. We are looking at close to 2 lakh injections and not one patient coming back with any allergic reaction or complication or side effect. Why? Because here we are taking 1 drop of the patient's own blood. This goes back into his own circulation. Your blood cannot fight you. So, no adverse reaction, no side effects, no complication. Yes, we still have one complication, and that is low blood sugar. As I told you, each injection is going to drop the blood sugar by 40 counts. I learn most of my work from you guys, especially first the press. I learn a lot from you guys. Then my audience and our beautiful faculty. What did we learn in this process is that we needed 10 injections. We needed a time span to remove one complication. What have we seen? In worst case scenarios, we have done their next gen sequencing. In one particular patient, for example, I'm just remembering one, he was blind. One particular gene had 14 base pairs deleted, complete deletion. After 6 months of injection treatment, we saw in that same place, in the same gene, 16 base pairs had come back. So like this was not a single nucleotide SNP. This is not a single nucleotide polymorphism. This was a very big one. Yet it came back. And this brought back patient's vision. In a similar pattern, SMPs we have seen many. So we are not just changing the patient's outcome when you talk signs and symptoms. We are taking the patient's inside, the mutation level itself. Your fetal DNA will go and change your own mutations. It is so much customized. As you all saw Dr. Lalit Kishore giving us the importance of customization. This importance of customization is down to the last molecule where manna is concerned. Whenever we give some antipyretic like Dolo, we are giving, let's say, Dolo 650. Who did the research on this? Caucasians. What is that 650 milligrams? It's not taken from the Indian scenario. It has been taken from the Caucasian scenario. Our Indian doctors, and we have so many of them here, will tell you that maybe sometimes they think, okay, this patient, I don't want to give 650, take half tablet. The doctor is using his acumen to tailor down that patient's need. But now and here, with manna, it is complete customization because you're giving back that patient his own fetal DNA. That's where the importance lies, that you can treat conditions where mutations have gone haywire. Every one of us is going to have mutations. Yes, madam. Mike. Hey, Mike,
sorry to interrupt you, ma'am.
You're
I've
not
been having a doubt since.
Sorry. That's what I'm trying to do here.
We have been teaching students about the DNA repair, right, ma'am?
Yes.
There are types of DNA repair. That is, we do base excision repair, nucleotide repair, and all those things. And as you said 14 nucleotides went and complemented the
16.
Okay, the deletion
Factor.
Factor. Right? There should be a DNA polymerase which has to take the nucleotides and go fit into.
Superb. For that research, I'm going to call you on.
Sure, ma'am. Thank
Absolutely
you so much.
true. See, I'm not really a scientist like these big people sitting here. I'm a simple doctor sitting in a simple country, in a simple city, and trying to do the best I can. And I don't want to see my patient going back and saying, I'm blind. That is the most important. I don't want the patient going back and saying that I'm going to die. Yes, you are all going to die. However, Narayan will pull his thread when he wants. It's the quality of life, the quality of vision that we are talking about. Life and vision can only be given by Narayan. We cannot dictate that. I don't know if you all have noticed, but I would like to tell you this. I'm taking my elder sister's permission through her eyes. We have not held ISGCT for the last 2 years. And if I know you guys will remember, yes, sir. Please, Swamiji. Here.
I have a question. Since you asked me some questions, you said that what life and everything is given by Narayan or something you said.
Yes, sir.
So can you?
Everything is given by him. But life and vision,
No,
we doctors can
no,
say we are very proud about. It's not.
I would like to know where Narayan lives.
Your
Does
heart.
my
In
heart.
every cell of yours, in every molecule of yours, in every atom of yours, in the quantum of yours,
But
every
that
single
you have to
area.
show in the screen.
I
that he
should show, I will.
lives-
Believe me, one day
lives,
I
you
will.
have to
I'm also
show
searching
us.
for that. No, I'll 100% give you that. But it will come
But
from
how,
quantum.
who was given this
It'll
name?
come from quantum. Why do I say it'll come from quantum? There's one fundamental rule where Narayan exists, that everything will have positive, everything will have negative, plus one. Yes,
No,
there we
no,
know. God particle.
my question is that,
Yes,
that
sir.
as you said, that it lives in heart. But heart is in a physical heart?
A physical heart, then you go down and down and down, every cell, every atom, and down to the quantum.
That means
So I'm just going from.
That means the conclusion of that he or she, whosoever, that does not live in heart, is nullifying your answer, is being
It's not in the
nullified
heart,
by yourself.
It's in every molecule. It's in every molecule you're talking about.
So every molecule lives.
Yes.
But how to prove it?
In your consciousness,
So that means through consciousness also.
inside
Then
you.
why you are giving the name to Narayan?
That is something that our Vedic scholars have shown us very nicely to give some names to some gods. And every god is not necessarily one or the other. They're all the same. I'm just using the word Narayan. Somebody would like to use Allah, Muhammad, Jesus Christ.
Yeah,
It
Muhammad
doesn't
is
matter.
not. Muhammad is not Allah.
God.
Muhammad
Sorry,
is
Allah.
a messenger of
Sorry,
God.
Allah. Allah. For me, I am just very blessed that I have inside me a father who is Hindu and a mother
No,
who is Muslim.
how to establish this? What you are saying is available in molecules. I would like to know from medical
How do we
science.
tag him?
How would like to establish it that it lives in all molecules?
How do we salvage him? There are so many methods. For example, I'll give you. We're talking science. If you're talking science, I'll give you one example. Have anybody of you heard of the double dark theory? Yes or no?
Yes, I have heard.
Solunga. Please tell me the double dark
The
theory.
double dark theory is where from this universe has emerged, the black hole. The one part of the black hole is universe, which we know, and other part of the black hole we do not know. Other side of the black hole does not know which is there in the other side of the black hole. About universe. That's what called the It's this side, this side of the dark hole, that black hole is this side does not know, and this side does not know about this side, and this side does not know that side. That's called double dark theory.
Before 2003, it was assumed that the darkness of the sky and of space is a vacuum. We did not understand anything further than that, and we understood that the stars are little illuminary bodies. However, there was a study done where they were playing monkey, and the phenomenon that was found was monkey in the middle. So they had thrown one radioisotope that way, another person throwing it this way, but in the middle came the monkey in the middle. So the monkey in the middle deflected the radio tag and it went away. That's when they understood there's something there.